Mal means bad. Malnutrition is an imbalance of total caloric intake or intake of specific nutrients. So malnutrition can either be inadequate intake or excessive intake. I want to look at a couple of examples of malnutrition, including kwashiorkor, which is a disorder where protein intake is deficient despite normal or almost nearly normal calorie intake total. It's characterized by edema of the abdomen, such as you see in the infant on the right side of the image. It can also be characterized by an enlarged liver, decreased blood pressure, low pulse rate, lower than normal body temperature, and sometimes includes mental retardation. Because the main protein in corn doesn't have two of the essential amino acids that are required for growth and tissue repair, many children that reside in African countries whose diet consists primarily of cornmeal develop kwashiorkor. Marasmus is a type of protein calorie deficiency that results from inadequate intake of protein and calories. So it's not just the protein. Its characteristics include retarded growth, low birth weight, muscle wasting, emaciation, such as you see in the young child on the left, very dry skin, thin and very dry hair, and also a lot of times the loss of the hair as well. Fever is when you have an elevated core temperature that's caused by something causing your thermostat to reset. So the hypothalamus, remember, is your thermostat. So the most common causes of fever are viral or bacterial infections or the toxins produced by bacteria. However, sometimes fever occurs during ovulation or excessive secretion of thyroid hormones, certain types of tumors, or reaction to vaccinations. When phagocytes ingest bacteria, they're stimulated to secrete a chemical called a pyrogen. Pyro means fire, gen is produce. So pyrogens are fever-producing substances. Antipyretics, fire, anti, against. So antipyretics are things that you take to relieve or reduce fever, such as aspirin, acetaminophen, or ibuprofen, and they all reduce fever by inhibiting the synthesis of certain prostaglandins that can reset the hypothalamic temperature. The opposite of that is hypothermia. Hypo, under, thermia, temperature. So it's a lowering of the core body temperature to 35 degrees Celsius or 95 degrees Fahrenheit or below. Common causes of hypothermia include overwhelming cold stress, such as you are ice skating or walking across a frozen pond and the ice breaks and you fall in, so you've been immersed in that icy water. Metabolic diseases such as hypoglycemia, adrenal insufficiencies, or hypothyroidism. Drugs, alcohol, antidepressants, sedatives, tranquilizers, burns, and malnutrition can all lead to hypothermia. But regardless the cause, it's characterized by the following as core body temperature falls. So sensations of cold, shivering, confusion, vasoconstriction, bradycardia, acidosis, muscle rigidity, hypoventilation, hypertension, loss of spontaneous movement, reflexive actions, coma, death. The death is usually caused by cardiac arrhythmia. Because the elderly have reduced metabolic protection against cold environment, coupled with the reduced perception of cold, they are at much greater risk for developing hypothermia. Alright, so if you're in my lecture class, I wanted to give you this as a warning before you go into the next few slides. There's a lot of information on there. What I cover with you in this video and what you have learned previously is what I'm going to expect you to know. For those of you that are not in my class, I hope you learned something really cool from this. We all have a human body. All of this is important, but I do want to point out a few things. So if you're in my lecture class, this is what we're going to talk about. Alright, so we're going to look at some of the minerals that are important to the body. You should already know the role of calcium. It's the most abundant mineral in the body. About 99% of it is stored in your bones and your teeth. Your calcium level in your blood is controlled by your parathyroid hormone. When calcium levels decrease, remember your parathyroid gland is going to secrete parathyroid hormone, and those osteoclasts are going to break down bone. What is bone? Calcium phosphate. So when that's broken down, it's released into the blood, and blood calcium levels raise. So what's the importance of calcium? Well, as you see, forming of bones and teeth. Calcium is also an important cofactor in blood clotting. Remember when we learned hemostasis and that intrinsic and extrinsic pathway, and how calcium played a role? Without calcium, some of the inactive clotting factors weren't converted to active. So blood clotting, pretty important. You know about muscle contraction from your A&P1. Remember the role of calcium. First thing, calcium caused that nerve cell to release the acetylcholine. So that's one role of calcium. But then think about in muscle contraction, when the troponin and the tropomyosin were covering the actin binding sites, and the calcium binds to that troponin, and it causes the tropomyosin to move off the binding site, so the actin and the myosin can bind and muscle can contract. You knew that already though, right? Of course you did. All right, so calcium. Phosphorus, about 80% of that is found in the bones and teeth because calcium and phosphorus hook up and form calcium phosphate. So what's its most important role? Forming of the bones and teeth. Potassium is the major cation in the intracellular fluid, so inside the cell. It's needed for the generation and conduction of action potentials in neurons and muscle fibers. Sulfur. Sulfur is needed to make proteins. We know that proteins are hormones and vitamins and minerals. Sodium, the most abundant cation in the extracellular fluid. It affects fluid and water balance because remember, anywhere sodium goes, water's going to follow. So helps to maintain fluid and electrolyte balance. Also, it's important in depolarizing those muscle and nerve cells so that action potentials can be produced and conducted. Chloride is the major anion, remember anion, negatively charged ion, in the extracellular fluid. Chloride, think hydrochloric acid, right? What do you think it's made of? Chloride ions and hydrogen ions, right? So its major role is in acid-base balance and the formation of that hydrochloric acid. Whoop, back up. Let's get it here. Sorry, this mouse is so touchy. Iron, you know what iron is, right? Most of the iron in the body is found in the hemoglobin. What does hemoglobin do? The iron binds the oxygen. What about iodide? Iodide is needed by the thyroid gland to make active thyroid hormones. Remember, your iodine is stored in the colloid of the thyroid follicles. Where do we get it? Remember, next time you buy salt at the store, you'll probably see on the label it says that it is iodized. All right, I'm going to do a quick flip through here so you see the others as well. Let's get this touchy little mouse moving. Bear with me. All right, manganese, copper. Yes, they're vital. Yes, they're minerals. They're not some that we consider in my lecture class for my exam. Are they important? Of course they are. Or am I testing on them? Nah. Cobalt, zinc, fluoride. Very important. Fluoride, you've got to have that for healthy tooth structure. Yeah, that's enough on that one. Selenium and chromium, they're important in making enzymes and normal metabolism. Yeah, that's enough. And next we'll talk about the vitamins. We'll begin with the fat-soluble vitamins. Vitamin A. Remember when Mom used to tell you to eat your carrots? Well, carrots, orange, yellow, and green vegetables, liver, and milk contain a rich source of vitamin A. And why did Mom tell you to eat your carrots? So your eyes would be good, right? So look over here. Light-sensitive photoreceptors in your retina. All right, that's eyes. Night blindness, cornea, all related to vision. So the main, or one of the main roles of vitamin A is for vision health. No, that's not all it does, but that's one of its main purposes or its main roles in the human body. Another fat-soluble vitamin is vitamin D. Have you ever noticed on most containers of milk it says fortified with vitamin D? Milk, great source of vitamin D. Why do you need vitamin D? You must have sufficient levels of vitamin D in order to be able to absorb calcium and phosphorus from the foods that you eat as it passes through the gastrointestinal tract. If you don't have sufficient vitamin D, then you can't absorb enough calcium, and it can lead to a condition in children called rickets or osteomalacia in adults. Fat-soluble vitamin E is stored in the liver and the adipose tissue and muscles. It's a good thing it's stored in the liver because one of the important roles is to help protect the liver from toxic chemicals. Now, you may hear of people taking vitamin E capsules and opening them and putting them on their skin, especially if they have an area that is healing, because it can help to prevent scarring. Our fourth and final fat-soluble vitamin is vitamin K. It's produced by the bacteria in your intestine. It is a coenzyme that's needed for clotting factors, for making those clotting factors in the liver, including prothrombin, remember? And prothrombin had to be converted to thrombin in order to convert fibrinogen to fibrin and cause blood to clot. Next, we'll look at the water-soluble vitamins, which include all of our B-complex vitamins. There are several of these. B1, it's important. Not important in that I'm going to test you on it. One thing I want you to notice about all these B vitamins, of course, most of these are going to be consumed in your diet other than the B vitamin, or these are all going to be consumed in your diet. But B12 is the only one that's not found in vegetables, and we're going to talk just a little bit about it. So I'm not going to ask you to know the specifics on each one of these B vitamins, other than a couple of them that I want to point out, just a couple of important things that we've already talked about, and I want to remind you of those. So your B vitamins, remember, are water soluble, which means that they are dissolved in body fluids, and excess quantities of your B's and your C's are not going to be stored, but instead they're going to be excreted in the urine. So you have B1 and B2, riboflavin, niacin, and B6. I do want to take just a moment with vitamin B12. Vitamin B12 can only be absorbed in the gastrointestinal tract if we have the release of the intrinsic factor. Remember, we talked about this with digestion. Vitamin B12 is a coenzyme that's necessary to make red blood cells. So if you have insufficient absorption of vitamin B12 because of the lack of intrinsic factor, that is, do you remember? No, but I know you can read. That was pernicious anemia that we talked about back when we talked about blood. So I did want to remind you of that as we are here looking at the B vitamins. The pantothenic acid and then the folic acid. I want to point out the folic acid, when you have a deficiency in folic acid, there is a higher risk for infants to develop, or when you have a low level of folic acid in the pregnant mother, there is a higher risk of neural tube defects in that infant. And our second major classification of water-soluble vitamins is vitamin C. Of course, vitamin C we know we get from a lot of our citrus fruits and some of our vegetables. Vitamin C is important in making proteins, especially the collagen that is used in the formation of connective tissues. So deficiencies of this can lead to scurvy, and anemia, and a lot of things that are related to collagen formation, including the connective tissues, the periodontal ligament, and the gums that help to hold the teeth in. Also, poor wound healing and excessive bleeding, because the connective tissues that help to make up the walls of the blood vessels start to degenerate. Now, vitamin C deficiencies as well can also lead to slow or retardation of growth in children.